What's up, it's your favorite NPHP, and welcome back to my channel. Today we're just going to break down AI in healthcare, specifically how nurse practitioners can utilize it without losing their minds, their license, or their patients. So we're going to talk about what is AI specifically, how is it being used in a hospital right now, how can NPs use it during their daily workflow, and what are the pros and cons of AI. So what is AI? Artificial intelligence. So basically, it's a software. It's a software that can analyze information, recognize patterns, and generate predictions or answers. It doesn't replace clinical judgment, right? Nor does it replace patient care. It's a tool. And like any tool, it's only as good as the person using it. So in healthcare, it can show up as decision support tools, charting assistance, predictive analytics, chatbot, imaging algorithms, and administration automation. So think of it as an extra brain, right? It's an extra brain that does not get tired, but still needs a little bit of supervision, okay? We can't put our 100% faith into AI, but it could definitely help us out. So how is AI used in the hospitals? So here are the most common areas. First is clinical decision support. AI can flag sepsis alert, AKI risk, abnormal labs, drug interaction, trending deterioration. It's not diagnosing for you. It's just highlighting what you need to double check. Closer monitoring. So second would be radiology and imaging. AI reads CTs, MRIs, and X-rays in seconds and helps prioritize critical findings like strokes and PEs. Third would be documentation and note generation. AI scribes listen to visits and generate SOAP notes, differentials, and discharge summaries. How amazing is that? Fourth is operation and scheduling. Hospitals use AI to predict bed flow, staffing needs, and OR utilization. Patient engagement. Chatbots handle triage, appointment reminders, and basic follow-ups. And remote monitoring. Wearables and sensors feed into AI models that alert teams to change in vitals and mobility. So this is happening right now, not in the future. So NPs, we need to understand it and not fear it. So here's how you can use AI in your daily practice, whether you're inpatient or outpatient. So it can help with faster differential diagnosis. AI tools can help refine differentials, spot rare patterns, or summarize guidelines quickly. Charting and documentation. AI scribes cut out charting time by half. When you're writing your visit summaries, your SOAP notes, orders, discharge instructions. But remember, you still need to edit and sign everything. Medication safety. AI checks drug interactions, renal dosing, duplicate medications, and guideline-based therapy. Predictive analytics. AI can alert you to deteriorating vitals, CHF flare risk, infection trends, or readmission likelihood. Patient education. AI rewrites complex diagnoses into simple language. It creates handouts and translates instructions. Administration tasks, so scheduling, reminders, billing support, and message sorting can all be automated with AI systems. So let's jump right into the pros of AI for NPs. The first being faster decision making. So AI cuts the time between identifying a problem and acting on it. Less burnout. When documentation and administration tasks shrinks, clinical fatigue goes down. Better patient safety, more eyes on vitals, medication trends means fewer errors, right? And early detection. And it can improve patient communication. Again, you can instantly create simplified explanation and educational sheets for them. It can increase efficiency. You can see more patients without rushing or sacrificing quality. So some cons and risk of using AI. So over-reliance. Some clinicians start trusting AI more than their own judgment, and that's very, very dangerous, right? Because in a court of law, AI does not stand trial. You, the provider, the clinician, the nurse practitioner will be standing in the court of law, right? Number two would be wrong outputs. Again, AI is a software. It's technology. It could have its hiccups. So it could hallucinate, it could misinterpret, and it could give you outdated guidelines. So you always must verify everything. Third could be the HIPAA risk. Free chatbots aren't safe. So you need to make sure you have a HIPAA compliant platforms with the BAAs. Bias. AI models can reflect bias in the data they were trained on, which affects the diagnosis and treatment. Fifth being workflow disruption. Poorly integrated AI tools can slow you down instead of helping you. And the legal gray areas, again, you, not the AI, are reliable for decisions. Again, in a court of law, it'll be you, not the AI standing trial. Before you use any AI tool, you want to look out for certain things. Again, the HIPAA compliance, BAA required. So data source, what training data we use, accuracy rates, how often the model is updated, explainability. So how does the AI come up with its information? And does it show you how it reached its conclusion? Especially when we're talking about healthcare, we're talking about diagnosis, we're talking about treatment plans. Integration with your EMR, security, cost versus value, the vendor's reputation, your own scope as an NP. All in all, if it saves you time, improves safety, and improves outcomes, it's worth considering, right? If it creates more work, I would say toss it, but like I said, AI is here to stay. AI is already here. So you just have to learn it. You have to understand it, get to know it a little bit better because, again, AI is not going anywhere. Major hospital systems are already utilizing it. And my hospital, I have already seen different AI little gadgets, tools popping up on my screen that I can utilize. So in summary, AI, it's taking away the boring parts of our job. Documentation, the scheduling, the data reviewing, the endless charting. It's not taking away our jobs. AI is a tool that can make NPs faster, safer, more efficient, as long as you use it wisely and you stay in control. Again, a big stay in control. And remember, don't let it take over. Don't let it take over your own clinical judgment. Learn it now so you're not left behind, as every healthcare system is using it as a standard practice, or at least will be using it as a standard practice. That nears the end of this video. If you want a deeper dive into specific AI tools NPs can use, drop a comment below and I'll make a full detailed video regarding that. Until next time.